My name is Christopher Michael Thompson. I am an interventional cardiologist. I went to college to study computers, and I was doing well. Came home that summer. My mother, who's an emergency room nurse, asked me how I like college. I said, well, the computer part's kind of boring, and it's typing on a black and white screen. There was no internet back then. And she said, well, I've always wanted one of my sons to be a doctor. As the oldest son, you want to please your parents more than the other siblings. So I said, well, I guess I could probably do that. And then she told me, if you become a doctor, you should become an interventional cardiologist. I didn't go to medical school planning on being an interventional cardiologist, but I think mom knew my personality, and I did become one, and I love what I do. I love cardiology in general because we understand the heart. We can fix a lot of things wrong with the heart, and there's some fields of medicine where you don't feel like you really make a difference. Like maybe you're preventing things down the road, but you never really see that, as opposed to fixing blockages and putting in pacemakers and shocking hearts back to normal rhythms and fixing congestive heart failure. All of those, you feel like you made people better, and they feel better, you feel better, and it's a satisfying job. So the patients that I treat is really the whole spectrum of cardiology, from coronary artery disease, which is what interventional cardiologists deal with, blockages, stress tests, cardiac angiograms, fixing blockages with stents, sometimes with surgery. But also as a cardiologist, you deal with lots of other issues like high blood pressure, congestive heart failure of various types. As a cardiologist, I think the most important thing is prevention. If you wait till you're 65, 70, 80 years old and already have blockages and a weak heart, it's kind of too late. It's much better to start in your 20s, 30s, 40s with healthy lifestyle, which includes eating a healthy diet, lots of natural foods, not a lot of the processed foods that most Americans eat. Exercise is a huge one and probably number one. So to me, a good patient-doctor relationship is about communication, which really takes time. I really like to sit down if I can, 15, 20 minutes, figure out what they do every day, exercise-wise, figure out what they eat, make sure they don't have the bad habits that I want to talk them out of, see what kind of symptoms they're having, see how their medications are doing. I like to explain what each medication is for, and if they're having side effects, what the alternatives are. What I love about Fredericksburg, I grew up in small town Indiana. I like the little bit slower pace of life. I like living 5 minutes from the hospital. I like being able to come into the hospital anytime I want since it's so close. I love our small town patients. They're very independent. I like that. They're very active. I like that. Any job, especially in Texas area around San Antonio, there's a high percentage of retired military, VA patients. And I feel like I relate well to them, having the shared experience. I was not just in the Air Force, but I also volunteered and worked at the Army. When I worked in Germany, I worked for the Army. I had two brothers in the Navy, so I'm from a military family.